Okay, so this is our annual in-service where I go over HIPAA, resident rights, our vulnerable adult abuse policy, reporting reasonable suspicion of a crime, and dementia. And you guys get a lot of this information on Healthcare Academy, so I'm trying to relate it more towards how it applies to working here at St. William's. So first of all, HIPAA, what it stands for is the Health Insurance Portability and Accountability Act. I know you've all heard the name. You have all probably had to sign forms about HIPAA and confidentiality, especially, you know, at clinics and whatnot. It's a law that's designed to provide privacy standards to protect patients' medical records and other health information provided to health plans, doctors, hospitals, and other healthcare providers. So what does this have to do with our residents here at St. William's? Well, just like me and probably the rest of you, you know, when you go to the doctor, you don't want just anybody obtaining your medical information. And I wouldn't think that our residents here would want that either. Our residents here have a right to privacy and to confidentiality. They have a right to personal privacy and confidentiality of his or her personal and medical records. So a couple of key points that are in the Resident Bill of Rights regarding our privacy practices for the residents is that the privacy includes accommodations, medical treatment, written and telephone communication. So the things you overhear a resident talking about to a family member or maybe to the doctor in the hallway, that's all kept private. The facility must respect the resident's right to personal privacy, including the right to privacy in their oral or spoken language, written and electronic communications, including the right to send and promptly receive unopened mail and other letters, packages, and other materials delivered to the facility for that resident. The facility shall respect the privacy of a resident's room by knocking on the door and trying to seek consent before you enter. So that's why before we enter a resident's room, we want to knock really loud, give the resident a chance to respond. By doing that, you're respecting their right to privacy. So how do we know who and when we can release information? Does anyone?
It's on the face sheet.
It's on the face sheet, yep. And I'll go over that. I actually have a picture of our face sheet, which is our demographic information for our residents. It goes over their emergency contacts, and then on that form I've also listed a little spot that's actually titled HIPAA. So on that HIPAA line, there's residents, family members, friends that they've given me consent or given us consent to release information to. So if they're not listed, they're not an emergency contact person, we're not authorized to release information to them.
And obviously all the staff who don't have access to the electronic health record, then what you would do is before you give out any information, you should direct them to the charge nurse and let them handle the questions.
Right, so like if the phone is ringing and you answer it, you don't know who's on the line, they're wanting to know what medications Millie is taking. If you're a CNA or, I don't know, if a housekeeper or laundry person would be answering the phone, but you would probably transfer it to the charge nurse. And then that charge nurse or, you know, an LPN, somebody who has access to the resident's face sheet or demographic information, they would check that piece of paper to see if they're on it. If they're not on it, then you would just politely let them know that, you know, because of HIPAA, we're not able to release that kind of information to them, you know, and tell them that you would be happy, you know, to refer them to me, to social services. If I'm not here, you can transfer the call to me and have them leave me a message, or you can take down their information, their name and number, and then I would get back to them as soon as I'm able. Okay, and this has actually happened quite a bit, and I've never once had any family member or resident's friend upset because somebody did not release information to them. I think if anything, they have a lot of respect for us because we don't just give out information to anyone.
Michelle? I would just want to say is, like, obviously asking for medications, a lot of you would even, you
Right,
know to
you
go to the
would.
nurse. But even if it's something as easy as, I heard so-and-so's not in the room. Are they here or,
Are they at the hospital?
Or at the hospital? We really can't even release that information, so that's where you'd have to direct them to.
Well, you can let them know that they're here, that they're resident of the facility
but
if
not
they're
if they went
listed
to the-
under our bulletin. If they're not listed on that, then they're considered a privacy resident, and you guys should all be getting that information too, and, you're hired and whatnot. But if they're in the hospital and they're not here in the facility and they want to know, well, I know Jane, isn't there. Is she in the hospital? What hospital is she in? Then all you can really say to that family member or friend is, Jane's out of the facility right now. I don't know when she'll be back. I'm sorry, I can't tell you where she is because of HIPAA. Then you can let them know that, you'd be happy to refer them to social services or to take their name and number down, and, you can look into it then, or maybe let the charge nurse look into it. Okay? So, we kind of already talked about this. The emergency contacts are listed on our admission record form. So this is what it is. This is what it looks like. On the bottom, you're going to see the contacts, and that's the emergency contacts. So you'll see the family members' names, their contact information. So if they're listed in that area, then we're able to release information to them. Then there's also that spot under other information that's called HIPAA. I had to write that in anyway, it's kind of sloppy, but look for that spot under other information, and then you can check to see if their name is there. So those are like additional people to the emergency contacts that might call, and want to know how mom is doing, or if their mom is in the hospital. Because, we have a lot of family members, or a lot of residents here who have family members that live out of state. Some examples that you guys might experience here is overhearing a staff member to a resident conversation. So you might walk by a room when I'm visiting with a resident and I'm talking about their finances. That information that you're overhearing, that's confidential information that should not ever be repeated. There's no reason to even repeat it to another staff person. Staff discussing a resident's medical needs or their concerns. So maybe you overhear a nurse talking to another nurse about a resident's wound, the size, is it a pressure sore? Where do they get it from? How long have they had it? Staff discussing a resident's personal cares. This is a big one. When was the last time you had a BM? That's personal information. That stuff shouldn't be asked, for one, out where anyone can overhear it. And secondly, you shouldn't be, there's no need to repeat it out in the hallway to somebody else, to let Bob know that Jane just had a BM and that's why it smells in the hallway. There's no reason for that. So,
And make sure they
residents-
don't talk about things in the break room.
Right.
Mention that.
Well, you can color that up for that. Lori was just saying that this also applies to in the staff break room. When we're on our breaks and stuff, we don't want to be talking about residents' personal information, when they went out to the hospital, what medication changes they just had, anything. We don't need to be talking about our residents in the break room. So how do our residents know their rights? When they first move in, they all get an admission folder. In that admission folder, they receive a booklet that's called the Resident Bill of Rights, and I go over that with them. So I let them all know that they have rights here, that their rights have not changed because they're in the nursing home, and I strongly encourage them to let me know if they have any concerns or any questions ever about their rights here. And then I review the resident rights at our resident council meeting. Our resident council meets once a month, and I try to make it every time. I don't always, but at those resident council meetings, I do go over 1 or 2 of their rights out of that booklet. And I bring the booklet with me, I show them the booklet, I remind them that I have them available, and I'm here if they have questions. And then also the Bill of Rights are posted in the nursing home in 2 places. One of them is over by the therapy doors going out in that entryway, and then the other one is down that north hallway. That's where they are right now. They might be moved in the future, I don't know. So here is a list of our resident rights. So you guys can just kind of look over them. It's pretty straightforward. Does anyone have any questions about any of the rights? Like the residents have a right to choose their own doctor, to participate in their plan of care, to live in a safe environment, the right to be part of the admission process, to be part of the transfer and discharge process, the right to have a relationship with other health services and providers.
Michelle? On the last resident council, let's see, right now, they just had one at the end of November. So the one in October, they had made, some residents had complained that they're not getting notifications regarding appointments. When they have appointments, or if they're gonna be down to see the doctor, they would like some notification prior to that. And I did notice on the resident information from their last meeting, it said that a lot of them feel like that has not improved. So we do need to get way better on that. So I just want to make sure everybody knows.
Absolutely, because they have a right to know of their upcoming appointments, and that is something that they've expressed at resident council. So that's nursing related.
Yeah.
So now we'll talk a little bit about the Vulnerable Adult Act and the Elder Justice Act. So we here are all mandated reporters. Okay, so we've been identified as professionals by law who have to make a report if we have reason to believe that abuse, neglect, or financial exploitation of a vulnerable adult occurred. So who do we report to? Does anyone want to raise their hand or just yell it out? Who do we report to? We have reason to believe that a vulnerable adult situation occurred.
Nurses or administration?
Okay, yeah. Technically, the reports, I guess is what I'm talking about, the vulnerable adult actual report, goes to OHFC, to the Office of Health Facility Complaints. We'll talk more about how we report internally here at St. Williams in a couple of minutes. When we report to OHFC, we have 24 hours to make that report. So the second you witness a vulnerable adult situation, or you have concern that a situation may have occurred, and you report it to your charge nurse, or you report it to Lori, or you report it to me, or to Tim, then we have 24 hours to complete that initial report and send it into OHFC. Does that make sense? So if something happens Friday night or Saturday morning, you can't wait till Monday morning when me, Tim, or Lori are in the office to do the report. Okay, it has to be done within that 24 hours.
But if there's a major injury, then you have 2 hours.
We'll talk more about that. That has to do with the reasonable suspicion of a crime.
No, that's a vulnerable adult too now. That's why we added to our policy.
Oh.
When the survey was here, that's when we had to update our vulnerable adult policy, because it isn't just reporting of the crime anymore, it's the vulnerable adult policy. If we have any report that needs to be done and it involves a major injury.
So like a fall that has a hip fracture?
Yep.
You have 2 hours?
We have 2 hours.
To report to OHFC?
Yes.
Oh, okay.
Yep. If during that fall, it isn't just, now the fall and an injury isn't all on its own reason to be notified. What the reason would be is if we were doing something we were supposed to do
So
that
if we were
caused the
following
fall.
care plan.
Right, if we weren't following the care plan and it resulted in a fall with an injury, then that would have to be notified in 2 hours. It gets to be really technical at times, so that's why whenever there's anything that you question, you should be calling me or Tim, just to make sure. When in doubt, call. And it has to be, you can't wait until after, like especially for nurses, you can't say, okay, I'm gonna wait till the end of the med pass and get this done and that done and then call us. It needs to be immediately, because we do have that time frame.
Okay, and then you guys have all probably heard this word thrown around a little bit, the ombudsman. The ombudsman is somebody who works for nursing homes and is an advocate for the residents and their rights. Our local ombudsman is Ann Holme. So every nursing home has appointed an ombudsman, and her contact information is posted, and by law it does have to be posted. It's over by Station 2, nurse's desk, in those little glass case area. So in 2016, our policy was updated to include taking photographs or recordings of a resident or their private space without written consent, which violates their right to privacy and confidentiality. So that includes going into a resident's room, even if the resident isn't there, and taking pictures of their furnishings. Maybe you're taking a picture of what their room looks like. Maybe it's really messy, and you feel like you should take a picture and show a family member, I don't know, or the resident eating in the dining room, you know, those types of things are part of our VA policy now. So it's not just like yesterday, you know, we had our Christmas party, Santa was here, all of the residents had a picture taken with Santa. If those pictures are posted anywhere, we have to have written consent from the resident or from their representative saying that it's okay, and the picture has to be a nice picture. I mean, it can in no way humiliate or demean the resident. So let's say you have a picture of a resident sitting on Santa and they have drool on their face. That would not be an appropriate picture to ever post. Even if the resident gives you consent, that could be a violation of our VA policy. Does that make sense? Okay. So that's what this here one kind of talks about, the slide. So I want to stress to you guys that we want you guys to feel comfortable reporting things. You know, if you have any reason to believe that something may be reportable, please report it. You know, if you're a housekeeper, you notice something, report it to the charge nurse, and then that charge nurse needs to call Tim or Lori right away and discuss the situation, and then from there they'll decide whether or not it's reportable. If it is reportable, how long does it need to be reported? So then they can start working on getting somebody to make that report, to file it to, you know, the OHFC. So all long-term care facilities must ensure that all alleged violations involving mistreatment, neglect, or abuse, or injuries of unknown source and misappropriation of resident property are reported immediately to the administrator of the facility and to the state survey agency. So Deb, this is kind of what you were talking about with reporting to the administrator. This is a regulation. So when the charge nurse receives that concern from a different staff member that possibly, let's say, theft occurred, that needs to be reported to the administrator immediately. And then when you're filling out that report to OHFC, you need to write in there that the administrator was notified immediately. Do you guys have anything to add to that?
when in doubt, just call. I think people hesitate. There's a lot of, nearly all the time, there's gray area.